Hello everyone, and welcome to another episode of 2 Minute Emergency. I am your host, Dr. Leslie, board certified emergency physician, international speaker, best-selling author, and professional photographer. And I am here today to bring you another episode of 2 Minute Emergency to help keep you healthy, safe, and out of the emergency department. So my topic today is contact lenses. Why? Well, this week is Contact Lens Health Week. So it is a time dedicated to make sure that people understand the proper use and care of contact lenses in order to prevent infection. Infection is the number one problem that contact lens wearers use. The contact lens wearers can be affected by. So let's talk a little bit about the number of people in the United States that wear contact lenses. It's over 45 million people. Now, I admit I am a contact lens wearer as well. I wore glasses up until just a few years ago and switched over to contact lenses and have been very happy with their use. So I'm glad that that happened and I got used to wearing them before COVID hit because as the people out there who are wearing glasses realize wearing masks and glasses usually does not go well. The fogging is horrible. So that's one of the things we all face if you wear glasses. So as far as contact lenses, the most important thing is the care for your contact lenses. Of those important factors, the most is not to wear your contact lenses at night. Contact lenses, with the exception of the extended wear, and I'll talk about that more in a bit, are to be taken out every single night. Now, when you're taking out lenses or when you're putting them in, it's important that your hands are nice and clean. You've just washed them, you've dried them off with a towel that is lint free. And you want to make sure your hands are always dry whenever you use contact lenses. Take them, whether you're putting them in or removing them. Now, on that same regard, you want to make sure that your lenses are never exposed to water. Now, why is that so important? Water is not going to harm them. You're right, it doesn't harm the lens, but our water can contain small microorganisms which can cause infection. So you always want to make sure your hands are nice and clean and dry. Another thing is you want to make sure that you wash your lenses. If they're to be worn again, you wash them every night, but you only want to use contact lens disinfecting solution. And you want to rub them and rinse them with that solution. Once again, don't run them under the water. Another thing you want to keep in mind is you want to store those lenses in a contact lens case. Don't put them just in in a typical glass or something like that. Never good to do. You want to keep them in a case. And that case too should be cleaned every day when you're finished using them because you're not supposed to reuse the contact lens solution. That should be fresh every single day as well. So you want to wash that case, still using disinfecting solution. And when you're finished, dry it off with a tissue. And to let it store, you want to store it inverted with the caps open. Because once again, you're trying to make sure that no bacteria is growing in that area. So this is some of the tips just for the contact lenses themselves. Now, I mentioned the risk of infection. So infection is the number one cause of problems with contact lens users. And that's generally if they leave their contacts in for too long. So the types of lenses, there are the disposable lenses, which are single use, which is what I use, and you throw them away every night. There are other lenses which are programmed disposable, which you may be able to wear for a couple of days, still taking them out every single night to clean them and store them appropriately. Then there are the extended wear lenses. And the time periods for any of these lenses, you want to follow the time periods that are prescribed by the manufacturer. Now, when you're prescribed these lenses in the first place, make sure you talk to your eye care professional. They'll be able to give you additional instructions on how long you're supposed to wear them. The other thing that can happen, and I've seen this in the emergency department, and that's why I'm bringing this up as one of the 2 Minute Emergencies. I've had patients who have left their contact lenses in too long. Now, the risk of that, you can have corneal ulcers, which is basically just what you think of as an ulcer of the corneal surface, and that can cause major damage as well as can even lead to blindness if it's kept in too long and you don't take care of the problem. So I think most people know to take their contacts out, but some people try to save a few pennies, and I understand, um, but they leave their contacts in too long. And I had one patient who left their daily wear lenses in for over a month. Now, that's not something I can take care of in the emergency department. That's something that I had to refer that patient to an ophthalmologist for further care because it actually required surgery to have that contact lens removed. So, of the utmost importance, except for those extended wear, which you can wear constantly without taking them out, anywhere between 1 to 4 weeks, make sure you take them out every single night. So, another thing you want to make sure if you're traveling, so you have your solution and everything else with you, always make sure that you have your glasses. You never know what emergency may arise that you can't wear your contacts. You need to take them out, have your glasses ready. Now, I forgot to mention one thing. When I was talking about not getting them wet with water, you don't want to shower with your contact lenses. Now, of course, I've also heard you're not supposed to swim with them, but I don't see how you could swim with them and expect them to stay in. At least not if you are like me and I open my eyes underwater. So that's another time to make sure you're taking your contact lenses out. Another thing about traveling is that, or anytime, you can have a risk of something getting in your eye, for example. So that's another reason to make sure that you have your glasses, because if you experience any redness, irritation, increased watering, you want to take those contact lenses out, wait a couple of hours. If it resolves on its own, all is well. But if any of these symptoms continue, or if you start to have any colored discharge from your eye, if you start to have any increasing pain in your eye, and of course, if you have any changes in your vision, you need to see an eye care professional. And that is of the utmost importance. We only get one set of eyes. Make sure that you take care of them. So, those were just some tips on this week, August 22nd through August 26th, for Contact Lens Health Week. So, I hope you found these tips useful and make sure that you take care of your eyes. Once again, I am Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these 2-minute emergency tips to help keep you safe, healthy, and out of the emergency department. Until next time, care and be well.